Today, we're moving from definitions to structure. Understanding CBT on the EPPP is about sequence, not just what the tools are, but when they are used. Let's begin with order. CBT does not start with deep schema restructuring. It starts by identifying the presenting problem and clarifying the automatic thought. The therapist first asks, "What went through your mind in that moment?" That is step one in intervention. Once the automatic thought is identified, the therapist examines the evidence. This is where Socratic dialogue and collaborative empiricism occur. The therapist and client become co-investigators. They evaluate what supports this thought, what contradicts it, what are alternative explanations. Only after that process is established does the dysfunctional thought record become useful. The DTR is structured homework. It formalizes the process. Let's explore the DTR a little closer. The dysfunctional thought record, structure for the EPPP. Today, we're breaking down the dysfunctional thought record and how it appears on the EPPP. The DTR is structured CBT homework designed to examine automatic thoughts and test their accuracy. It follows a predictable sequence. Step 1. Identify the event. This is the triggering situation. Step 2. Identify the automatic thought. This is the spontaneous interpretation that occurred. Step 3. Identify the emotion and rate its intensity from 0 to 100. That numerical rating is important. The EPPP may describe mood intensity scaling, that's CBT structure. Step 4. Generate an alternative rational response. This is not positive thinking. It is evidence-based reappraisal. Step 5. Re-rate the emotion and observe behavioral changes. The purpose of the DTR is to operationalize collaborative empiricism. It transforms subjective thought into testable data. If a vignette or question describes structured thought monitoring, numerical emotion scaling, and evidence examination, you are in CBT territory. Recognize the structure, and the answer becomes clearer. Dysfunctional thought record, DTR, rapid recognition for the EPPP. If the therapist assigns structured homework to monitor thoughts, that's CBT. If the client is asked to record the situation, the automatic thought, the emotion and its intensity from 0 to 100, an alternative rational response, and the outcome, that is a dysfunctional thought record. If you see mood rated on a numerical scale, especially 0 to 100, think CBT. If the intervention focuses on testing evidence and replacing distorted thoughts, think CBT. The DTR operationalizes collaborative empiricism. It turns thinking into observable data. Recognition of structure leads to correct answers. Let's reinforce the DTR. Okay, so we have the event, the automatic thought, the emotion and its intensity rated from 0 to 100, an alternative rational response, and the outcome, including any shift in emotional intensity. If you see structured thought monitoring and numerical emotion scaling, you are looking at CBT. Now we can talk about how the EPPP tests this. The exam rarely says CBT. Instead, it describes the mechanism. If the vignette emphasizes evidence testing, structured homework, active therapist involvement, and present-focused problem solving, that is CBT. If it explores early childhood origin without structured testing, that is not classic CBT. If it focuses on reinforcement schedules, that may be behavioral activation. If it focuses on exposure hierarchy, that targets anxiety through habituation. Then identify the layer. You must identify the layer. Schema, automatic thought, distortion, behavior, DTR, sequence matters. When you recognize the structure, the answer becomes clearer. Mastery is not memorizing techniques. It is understanding where you are in the model. Order of CBT intervention. Test relevant sequence. When a CBT vignette appears, the process typically follows this progression. 1. Identify the problem, clarify the presenting issue. Define the target behavior or emotional distress. 2. Identify the automatic thought. What went through your mind? CBT intervenes at the level of automatic thoughts first, not schemas, not distortions directly, not childhood history. 3. Examine the thought. This is where Socratic dialogue, collaborative empiricism, evidence testing begin. 4. Introduce the DTR, homework tool. The dysfunctional thought record formalizes the process outside session. It is structured practice. It operationalizes the work already begun. So the DTR is not the first strategy. It is the structured continuation of cognitive restructuring. Why this matters for you? Because the EPPP often asks, what is the therapist's next step? If the client has not yet identified automatic thoughts, you would not assign a DTR immediately. You would first clarify the thought sequence matters. How the EPPP tests CBT. If a vignette says, the therapist asks what went through the client's mind, that is early CBT intervention. If it says, the therapist assigns homework to record thoughts and rate emotions from 0 to 100, that is the DTR. If it says, the therapist explores early childhood origins of belief patterns, that is not classic early CBT. That's a trap. Clinical logic hierarchy. Think of CBT like this. Problem to automatic thought to distortion to evidence testing to DTR to behavioral experiment. The DTR lives in the middle, not at the start. We have exhausted the application of the DTR as far as we can go. In the next section, we will bring everything together with some application questions. Start your engines. Ready, set. Let's go.